I was frozen to tip-up town at Houghton Lake. I got frostbite in my face.
Oh no.
It turned out okay. Obviously, it wasn't much to start with.
Does your health insurance cover that?
Ha ha! No, seriously, the state police. We were on our way to Houghton Lake, and the state police stopped us, and they had shut down the roads. It was the snowmobile trails because it was too cold. And I
Ah,
thought I thought I had ice on my face, and I went to scratch the ice off, and it was frostbite. If you've ever been frostbite, it feels like ice. And I
Okay.
scratched it off, and I bled a little bit, but I had no problems at all.
All right. I am
I
ready to
had lunch.
continue to do the introduction so that Bob can get started. So, um, Dr. Robert Frank is a retired Wayne State University professor, and today he is going to discuss our vision for healthcare for all. So, we're going to learn a little bit further about how we can respond to those who want to undermine our current healthcare systems that protect older persons and low and moderate income people. So, I'm going to go ahead and let Bob take it away with his presentation for today.
Thank you, Danny. Can everybody hear me?
yes.
Yes.
Good. Did we ever going to get Randy back, or is that the ball game for Randy?
I will let him back in if he arrives again, but if
Okay,
not, I am happy to help coordinate.
great. Um, Thanks for the nice introduction, Danny. Appreciate it. Just a little bit more about me. I practiced medicine and taught medicine at Detroit Receiving Hospital for 30 years, and I was the chief of medicine at Receiving. And then I became the education dean at Wayne State University School of Medicine in 1992. And then in 2004, I became the dean of the medical school. And then I retired from Wayne in 2011. I had a sabbatical until 2013. I consider myself an activist physician, and I have been for my entire career. I strongly support a national health program like the United Kingdom's, which would not only ensure everyone under a single public payer, but would revolutionize the delivery of health care. So I want to make that distinction. Our fight today is to get people insured. My position is that's a great first step, but the system itself, besides the insurance component of it, is badly broken. And we need a lot of work to make it better. I'd like to just do a brief presentation, hopefully not too long. I'm not great at these kinds of presentations. My students always used to tell me, you know, Dr. Frank, you're much better at the bedside. Um, so I hope that we can have a dialogue, because I know there are people on the call here who have lots of experience and information. And if I say anything that you disagree with, please let me know. I want to begin with something that I just got the other day. So I'm a Wayne retiree, so the med school sends out a daily newsletter that talks about what's happening in healthcare. Um, so the newsletter 2 days ago was this: the new University of Michigan Hospital opens in Ann Arbor, a 12-story building. Somebody said it's more akin to a trendy hotel than a
Yeah.
hospital. It's going to cost $920 million. In this region, the competition for healthcare in terms of new healthcare projects has reached $4 billion over the past few years. Henry Ford Hospital is opening a new tower in Detroit that's costing $2 billion. The University of Michigan bought the old Kmart headquarters in Troy, and they're opening a $250 million clinic there. Trinity Health is redoing its emergency room for $60 million. Corewell Health is opening a Care Center in Royal Oak across the street from the main hospital to the tune of $75 million. I just happened to pick that up 2 days ago. And when you look at that, don't get me wrong, I'm not a medical Luddite. I don't believe that we need to go back to the days when we didn't have any of these incredible advances in medicine that have helped all of us. However, you can see that this kind of patchwork quilt in Michigan, where you pretty much willy-nilly can build anything that you want, doesn't necessarily serve the needs of the people of this community. There used to be a very strong certificate of need program in the state of Michigan. I don't know what happened to it. I remember the UAW always had seats on that commission. And in order to get something like a new surgical center, you had to prove your case. And it wasn't easy. I went before that commission as dean twice, excuse me, and I was denied both times. So this is just something to keep in the back of our mind when in fact, we have people that are lower income. We have working class people with decent jobs who are not able to afford health care and are about to be threatened seriously with the Trump administration in terms of cutbacks in Medicare, eventually cutbacks in Medicaid, eventually cutbacks in Medicare, and of course, the Republican Party, for some reason, its white whale is the Affordable Care Act. In the United States, I want to just a brief bit of history because I've been a part of a whole bunch of different groups, including Physicians for a National Health Program, and we've looked at why the hell is it so hard to get decent healthcare insurance for everybody in this country? One of the wealthiest countries in the world, if not the wealthiest, and everybody knows that not almost, every industrialized country has healthcare for its people. Almost all of them believe healthcare is a right. There are many third world countries that have healthcare. One of them is right offshore Florida, country of Cuba, poor little Cuba. After World War II, President Truman had a problem. And that problem was workers were demanding higher wages. And he was very concerned that this was going to set off an inflationary spiral. So he went to the head of Kaiser Steel, Henry Kaiser himself, and said, look, instead of offering workers higher wages, let's offer them something else. Let's offer them health care. And that was sort of the beginning, in heavy industry anyway, of private industry offering health care to its workers. And that's important because in this country today, roughly 60% of all the people in this country are still covered by health plans that come from their employers. Some of these plans are great. We were talking a little bit about them before. Auto workers still have decent, especially older auto workers still have decent coverage. However, many people are not covered, and that led in 1965 to LBJ passing Medicare, followed by Medicaid. And by the way, the AMA vehemently opposed both Medicare and Medicaid and said it was the first step towards socialized medicine. And then they finally shut up about it because doctors got wealthy off of caring for patients who had Medicare. However, there were still many people that were uninsured, and President Obama, betting his entire political career on it, passed the Affordable Care Act. And that Affordable Care Act was actually, in my opinion, revolutionary. The problem with the Affordable Care Act is it's still very expensive, therefore the need for subsidies. And secondly, Obama wanted a public option in the ACA. And the insurance industry met with him in private and told him very simply, if you keep pushing the public option, this thing's going to be dead in the water. So it got taken off the table. And a public option, of course, means that even if you're 50, you would have an option to buy into Medicare. which would still be a better plan for you than many of the plans that are offered for people today. We're not going to go into how good Medicare is. Yeah, there are problems with Medicare, but by and large, it's run well. It has a reasonable budget, and it doesn't have to pay billions of dollars to executives, and it doesn't have to pay trillions of dollars for advertising. So we have this patchwork quilt with Obamacare, which includes other things too, like CHIP, which is healthcare for insurance for kids. It has the VA, which is another whole system. It has an insurance mechanism that covers federal employees. And at the height of Obamacare, approximately 8% of the population in this country had nothing, zero. So 92% had something. Now, some of the something wasn't great, was still high deductibles and a whole bunch of other things. So the question, of course, becomes, is there a better way to insure the US population? I think the answer is simple. Yes, there is. It doesn't matter what you want to call it, single payer, Medicare for all. And I think, quite frankly, for a whole bunch of different reasons, not least of which is economic, we will get there. I may not be around to see that, but I think eventually this country will move towards some kind of a public single payer. And the question, of course, is, well, why aren't we there yet? And the answer is really pretty simple, and that is that very, very powerful forces like the insurance industry, the pharmaceutical industry, the industries that build hospitals, the industries that supply hospitals with durable equipment, and I hate to admit it, some physicians' organizations have all been opposed on because of financial reasons. Most of the BS that comes out about why this is a bad idea for the American people is crap, and it centers around the fact that the insurance company is threatened to its core by a single payer. Because by definition, a single payer would probably mean that many of these companies would be out of the healthcare business. The other thing that is probably somewhat important in terms of why it's been so hard to get to something good like this has been this whole thing about American exceptionalism, which is that we are different than everybody else. We pull ourselves up by the bootstraps. If somebody doesn't have health insurance, it's their fault. You know the kind of mantra. And I think that's probably used in a whole bunch of different scenarios. Now, there have been several attempts at the state level to have Medicare for all. And by the way, that's how Canada got its national health insurance program. It was province by province. The state of Massachusetts, under Mitt Romney, has basically created a plan for the state of Massachusetts that covered everybody. State of California has tried on a number of occasions to get a plan and is still trying for the state. The state of Colorado was probably one of the closer states to getting it until the insurance industry poured millions and millions of dollars to defeat it with all kinds of ads, like you really want the government into your medicine cabinet, blah, 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 blah. And the proposal in Colorado a few years ago was defeated. Okay, so how do we go from where we're at now? And we'll come back to the threats. So it isn't just like we're slowly moving forward. We were slowly moving forward, and now we're about to take 2 steps back. I have a concept that I've kind of used in my own political life, which I call radical incrementalism. And it sounds like an oxymoron, but what it means is taking small incremental steps that are very meaningful, and eventually these quantitative changes can lead to qualitative changes. Let me give you a few examples in healthcare about how that works. Well, one thing is the move towards salarying physicians. You may think, well, how does that help? Well, in many places, physicians are now salaried. I mean, there's examples. Big example here, of course, is Henry Ford. Mayo Clinic was probably one of the first, Kaiser. What that means is it takes the incentive away from physicians to do things that will reward them financially if they're not medically indicated. The move towards non-physician providers. Now, of course, this is controversial, and still the AMA opposes everything that has to do with giving nurse practitioners and clinical nurse specialists and physician assistants more control over their practices. But this has had a major effect in this country. Of course, Obamacare, as I already talked about. I'm having a little trouble reading my own writing. Biden's negotiation with Big Pharma, they're incremental steps, but they're steps that are definitely worthwhile taking. And as I already mentioned, at least 3 states have taken up Medicare for all. Even the state of Michigan, there is a bill in the state of Michigan. It's hasn't really gone very far. The Michigan Universal Healthcare Access Network is supporting it, called MyCare, which would be a mechanism to insure all the people of Michigan under a single payer. Hospital unions are also important in terms of pushing, and I think the best example of that is nurses' unions. Because nurses' unions have shown that when they go out, it isn't just for increase in pay. Nothing wrong with increase in pay, but that's not the only reason they go out. They go out more and more and more because of patient care issues. Because they know that in an intensive care unit, you cannot take care of 10 patients with one nurse on a shift. And of course, Medicare and Medicaid. These little and somewhat not so little steps have pushed healthcare in this country in a good direction. We're not going to talk at all today about medical technology. Everybody knows that there have been some incredible advances that have prolonged people's lives, although I think it's important to come back to the things that really help people the most is excellent public health and good primary care. Now, as I said earlier, we've taken 1 step forward and we've taken 2 steps back. And those steps back are the attacks on Medicaid, privatization of Medicare. Okay, I don't know how many of you are in Medicare Advantage plans. They're attractive in a lot of ways until and unless you really need something big. So the biggest Medicare Advantage plan, I believe, is United Healthcare. And it's the plan that underwrites the AARP Medigap policies. Everybody knows about United Healthcare because the CEO was killed in, I don't know, it was about 1.5 years ago, maybe, in New York City. United Healthcare has the record for denying. So one of the ways these Medicare Advantage plans work is, well, first of all, the federal government has sold the responsibility to these private companies to insure people. So even though Medicare is footing the bill, the management of these plans is done by private insurance companies. The way they make their money is a couple of ways, but mostly the way they make their money, well, 2 things. One is they deny. So they're very good at saying, no, this person doesn't need it. We're not paying for it. And then that person and that person's physician has to beg, borrow, and steal to try to get the company to say, okay, because usually, I think the statistic I saw that was 80% of the denials under Medicare Advantage would have been approved under straight Medicare. And then the other way that that they make money is they overbill Medicare. And that's been going on since these plans were developed. I think they came in under Bush 2. Okay, so what do we do now? Well, we do what you guys are all doing and what we're doing in Michigan and other progressive organizations. We must defend Medicaid, absolutely. And that's a real threat. And once again, it's people that are on the lower part of the income, lots of people who work every day but cannot afford decent health care insurance. All these barriers get put up to people so that they can't use their Medicaid, or they get tossed off their Medicaid, or it becomes too difficult to figure out how to negotiate Medicaid. The second thing we must do is defend the ACA. Now, just a word on the ACA. Even though it was a fabulous plan, there are problems with it. And one of the problems is it has to be subsidized for people to afford it. That problem would go away if we had Medicare for all. We need to write our senators. We have I have a representative here in Debbie Dingell who's very positive. Not only has she been promoting healthcare for all, her husband promoted it before he died, and his father promoted it when he was in the House. And we need to march and we need to make our voices known. At this point in time, that's the power that we have, and hopefully that'll change. But that's kind of where things at. We are in a defensive mode. Now, having said all of that, with all the things that have happened lately, with the shutdown and the Republicans getting blamed for a lot of it, it's possible in my mind that the Republicans are looking for a win. Maybe they don't care, but I think they might be. And if I were able to get into the room, what I would negotiate is not just to put the subsidies back, but to allow a public option to come back into play. Because with a public option, we have a natural experiment to show that we can do better with a public option than the private insurance companies can do. Okay, I think I've been talking long enough. Can we, Danny, I think we lost our chair here. Can
No,
we?
I'm
Oh.
here.
Oh, good.
Yeah. I've been here for a while.
Okay, good, Randy.
I can see that Dr. Paul has had his hand up, and I'll just say that Dr. Paul is really a real doctor too, and that's an understatement. So his question.
I'm a retired doctor.
Hi, Dr. Paul.
Yes, I've supported Michigan and Michigan enhanced Medicare for all for decades now, probably. But at any rate, question: when you were talking about Medicare Advantage plans, I agree with you that it's really a scheme, and I think it was a scheme by the Republicans to try to essentially privatize Medicare.
Yes.
And seems to be working. That more and more
Yes.
people are coming in, and I was wondering about number one. You always have to give your zip code when you apply for that kind of program. Is that a way of cherry picking who the patients are? I mean, the fact that certain plans are only available in certain zip codes. I mean, can you get a better Medicare Advantage plan because you're like in Oakland County versus Detroit or?
That is an excellent question, and I don't know the answer to it. I'm kind of thinking you probably can. Because the way the insurance companies work, as you know very well, is it's all a matter of looking at the population of patients that you're enrolling. Of course,
Right, like
enrolling
UnitedHealth.
people. Yeah, enrolling people that are healthier, younger, less likely to use your services. And so once you come into, for instance, the city of Detroit, you've got a much older, sicker population of people that are going to use a lot more services.
Yeah, and you mentioned these enhanced services that are they draining money from the traditional Medicare program to support those programs? Like when they say you get dental care and hearing care, and you even get gym membership and even food subsidies or over the counter drugs, give you cash for that. Is that draining the traditional Medicare
it is.
program and speeding up the insolvency problem?
Yes, it is. And by the way, in my Advantage plan, which I was mentioning earlier, the University of Michigan just dropped like a hot potato, leaving my wife and I completely out in the cold. In my Advantage plan, I had an option to do a virtual visit with a veterinarian for my
Oh.
dog.
Oh, I thought it was for you. I thought I'd put the veterinarian for people.
Nope, this is for the dog. Anyway, by the way, some of these added things that are supposed to be so great, like you mentioned, quite frankly, they're not that great. You know, they're over the counter program. So in my plan, there was you had $110 per person that you could use for over the counter stuff. Most of the stuff was not stuff that most people would use. There was never a brand name of anything. And you know, the gym membership, I don't know, it seems to me to be kind of a lot of fluff. However, you're absolutely right. Over 50% of Medicare recipients now are in Advantage plans. And you know, they're attractive in the beginning. And as I said, until something horrible happens and you really need them, then the problem begins.
I had a
We have
brother who
some
was
other questions. I wanted to make sure that everybody gets a chance to ask questions here.
all right. Randy's blocking. It's okay, Randy. I'll ask.
We'll come back to you. We'll come back.
Come back to
Well,
you.
some people are more thoughtful than others, but hey, we got to give everybody a chance.
Sorry.
Okay, who's next?
I saw Dave waving.
Oh,
Dave was just waving hello. Dave and I are on the same board together.
I'm in a Medicare Advantage. I didn't know that it was 50% of Medicare. I didn't realize it was that high.
50, I think it's 52 now.
No kidding. Okay.
Yeah.
We decided, my wife and I we live in the metropolitan Detroit area. We've been at Henry Ford for 25 years. And I'll be frank, one of the reasons that drove me to Henry Ford was much plainer than the Beaumont system. They didn't have the flowers, they didn't have the fancy stuff. I've watched as Henry Ford has gotten more flowers and fancier artwork and all that. It's amazing the changes. And I guess it's the leadership. I don't know. But
Yeah, without a doubt.
yeah, I have no issue with my treatment, but our congressman, God bless, I can't think of his name, the person that introduced Medicare for All on day one of the Congress when it came back every year.
John Conyers.
John Conyers, God bless.
Conyers, yep.
Conyers, I was at a meeting with him, and it was a very, very small meeting in a church on the west side. And there was only about 12 or 15 of us, 15 at the max. And this is now 10 years ago. And he says, my advice to you is he says, I've got better healthcare than anybody here. He said, I can't complain. He said, but my advice to you is get a Medicare Advantage plan. He said that we gave the Republicans at their insistence put more money into Medicare Advantage programs. Now, I don't know if it's still true, but 10 years ago, there was significant more per person to a Medicare Advantage plan than was to a regular Medicare. And he said that from what I'm seeing, and here's a man that fought all his life for healthcare for all, was
Wow.
admitting himself, and it hurt to hear that. But I would Medicare Advantage plan.
Yeah. By the way, back to Henry Ford for a minute.
Yeah.
Okay, if you have, you can see that that's right in line with the new University of Michigan hospital. First time I walked in there, I was greeted at the front door by a chef, a guy with a big chef hat, and he was welcoming people to come over to the chef kind of pavilion. When I was the medical school dean, that hospital opened, and the president, the CEO of Ford at the time, oh my gosh, I can't believe I'm forgetting her name. Somebody help me. She was a nurse, and I'm blanking. Who? Nancy Schlichting. Nancy Schlichting. And I thought she was a fabulous CEO, by the way. I really did. Anyway, I got invited to the opening, and I'll never forget this. They had a feng shui expert talking about how they situated the rooms for the proper light. Okay. I've visited several countries and their medical facilities. If you go to England, you'll see that most of the hospitals have 4 people in a suite, 4 patients. They deliver excellent healthcare. The problem with healthcare in England, of course, is the right wing in England wants to defund it. If you go to Cuba, which I had the pleasure of doing quite a few years ago, you see how a country with very, very little in the way of money can provide healthcare, good basic healthcare to its people. Anyway, my whole point with Ford was that was my first introduction to feng shui. From my point of view, none of this should enter into these decisions. You can do a lot with a lot less. You don't have to build the temple to medicine and do great work. And by the way, once again, that doesn't mean that some of the incredible advances that have come out, especially, just a side note, advances that come from public funding of major public universities, right? So somebody comes up with the fact that you can now treat Huntington's disease. What do you got for Huntington's disease? It's deadly. It's a horrible way to die. People die in their 40s. Now there's a treatment that does not cure you, but it prolongs your life and gives you decent quality of life for several years. The reason that's possible is because a basic science experiment in one of the great public universities was done with these little microscopic worms. Yeah. So anyway, point being, we've got a president who wants to basically defund our entire academic and research infrastructure. And I don't want to be thought of as somebody who isn't a big fan of new medical breakthroughs. However, like I said, that pavilion at Henry Ford, the University of Michigan pavilion, and by the way, they always have good reasons for it. University of Michigan's reason is every bed in our new hospital is a private bed, and it's capable of being turned into an ICU bed if it needs to be. And the reason for that is more and more patients that are admitted to the hospital now are sicker. Okay.
Oh, anybody else got a question? I've got 2 or 3.
Let's have one from you. Oh, Bob?
Yeah.
Who's on now?
Well, I don't know. Bob, do you
Okay.
want to ask a question or make a
Can you hear
comment?
me? Can you hear me?
Yeah.
Yeah.
I had a couple things to point out. I agree with you. You have to watch the Medicare Advantage programs, but some are good. And I'm going to explain to you. I work with the UAW, and we have the auto workers, and then we have state workers, and then we have the private corps or the independent. And we do have some schools involved. But when you look at the retirees, any retiree with the state of Michigan has a good healthcare program if you were hired before 1998. With the auto company, it's 2007. Anybody after that is not entitled to healthcare through the auto companies or with the state of Michigan. They have to buy their own.
Oh, wow.
So what they've done is divide us apart. Okay.
Yeah.
What happened with the auto workers is with this VEBA under Gettelfinger, their money was put in a trust. And that trust was managed by, a few people there. I think there's 10 or 15 people on the board. But here's the key to what has happened. Prior to 2019, I had complaints about co-pays, deductibles, and the good old surprise bills that you didn't see coming from anywhere. Since this past year, they had to evaluate the trust because so many people died during COVID that they
wow.
had this excess amount of money. Because it's in excess, they cannot use it to pay more to the administrators, etc. They have to put it back in the trust.
Okay.
So everyone with a UAW auto trust, and they're separate, all three of them, but everyone there has no co-pays, deductibles. They're given $200 this year to go to the pharmacy and buy over-the-counter stuff. Next year it's going up. They're getting a $700 check that they can apply for or just use it for co-pays and other things. So, and they expect that to go up next year because it's in a trust. That's what we have to think about with our healthcare dollars. That's what FDR wanted to do, that we would put it in a trust and it be defined to be used just for healthcare. I just wanted to throw that out. Plus, Blue Cross Blue Shield, when it started, the doctors had to put money into a fund, and that fund was only used when you went to the hospital. So anyway, I just wanted to add
Very
that.
helpful. Those are great comments, Bob. I'm learning
Yeah.
something here today.
Oh, I see Dr. Paul's got his hand. I know he's been very patient.
Well, why don't you ask your questions, Randy, and then I'll give you a chance. Sorry.
Yeah.
I just wanted you to not forget I had something else I wanted to ask.
My questions have to do with, because we always with Gray Panthers, we want to do more than complain or raise our awareness of issues, but we want to take some kind of action. So our motto is age and youth in action. So what kind of actions are you seeing? And I know that you said we need to be advocates for single payer, but it may not come right away. I'll put it that way. They've got there's supposed to be a meeting happening proposed in the US Senate here by the second week in December. So there's a time frame there for where they might be doing some renegotiating about the Affordable Care Act. And I know we've been hearing a lot of critical comments about the Affordable Care Act, but do you have any thoughts about what kind of groups or what kind of action should we be taking to to push for that Affordable Care Act prior to the middle of December? What do we do, and what's the advocacy position?
Yeah, I think there are a couple things. One, I will be amazed if anything comes out of that meeting. And I hate to be negative, but that's number one. But number two, having said that, Michigan is proposing that all of us call not only our own senators, but other senators who may be sitting on the fence and try to push them towards doing the right thing here, at least taking a step in the right direction. Second thing is, keep an eye out for a bill that'll be introduced by Representative Reingans into the state legislature called MyCare. And that's something that I think is really worth looking at and getting behind. Number three, State Senator Sue Shink. She's my senator. She's made a proposal to start something called the Drug Affordability Board. So it turns out in other states, they have something called drug affordability boards that look at why, for instance, a certain cancer drug is so expensive that it's bankrupting people. And then they have the ability to work with that company to bring the costs down, et cetera, et cetera. So this is in the early stages. The bill has been introduced. I think it's called, there are three parts to it. Michigan Senate Bill 3, 4, and 5, I think. The other thing is look at Michigan's website. So luckily we have your Danny helping us redo our website, which was woefully inadequate. But if you're interested in keeping up with what's going on in healthcare, I highly recommend checking it out once we get it all set up. We do comb through something called Kaiser Health News, which is a nonprofit spun off from Kaiser Corporation that is an excellent source for what's happening and where you can get involved. So those are a couple of suggestions. Randy, I think the most immediate one would be to make sure that our representatives, and I think we're pretty good with certainly with Slotkin. And it's probably worthwhile, you know, Gary Peters doesn't have much to lose. I thought his timing was terrible stepping down now, but Carl, is that a relation? Carl, is Gary Peters a relation of yours? Did I just insult you? Anyway, yeah, so any kind of pressure we can put on now, I think is worth it. You know, we still live in a democracy.
So that second bill, the second one was a state bill. Is that called My Care?
And so it's MI Care.
Okay.
And Carrie, I'm not sure of pronunciation, her spelling of her last name, Reingans, Rheingans, I think.
That's correct.
Yeah.
So my second question had to do with the big threatened cuts to Medicaid, which is health insurance that's shared by both the federal and the state level. And they had close to over $800 billion being cut out of Medicaid at the national level. And I believe there is there a coalition or groups of people that are working on that?
Yes.
I know that this proposal that you were looking at, in either case, I would like to know more who are the allies and strategies having to do with standing up for protecting Medicaid, which not only protects low-income people in terms of their health care, but also is a major source of help for people who might need long-term care, older
Absolutely.
people often in nursing homes. So what are your thoughts
Well,
about?
we probably have a little more time because the Republicans carefully made sure that the Medicaid cuts don't go in until after the 2026 election. But there are groups, first of all, I think we have a good governor in the state of Michigan, and there's been a fair amount of movement to see that Medicaid in the state of Michigan is somewhat protected. However, these gigantic cuts are going to be hard for any state, I think, to kind of weather. Again, Michigan is a good place to look in terms of what we're doing. There are a number of groups across the metropolitan area in Detroit that are working. I don't know, is Val on the call?
Yeah, Valerie
No.
Prizuera.
No.
No.
Yes,
Okay.
I'm here.
Oh, Val, it's Bob.
Hi, Bob.
The question Randy had was other coalitional setups that are working to preserve Medicaid, like Moses, and I know you know some others.
Yeah. Well, I don't know any of the groups that I'm affiliated with have that on their agenda around healthcare at this time.
Okay. Okay. And then, of course, for people who live in metropolitan Detroit who don't have progressive legislators, that's even more important to try to get a hold of them and let your voice be known.
So yeah, I think that if we're sending a letter to our state senators, we could have letters to our state senators for the state legislation in terms of, but also letters to our members of Congress. So there's opportunity to include not just the need for universal health care, but also to protect the Affordable Care Act and to protect Medicaid.
Absolutely.
So these are all different options for healthcare security and things like that. Am I on the right track with that?
Yep.
Okay.
You got some hands up there, Randy.
Yeah, I see. Well, Dave and Paul. Uh,
Take
no,
Paul first.
okay, Paul.
I'd like to add something real quick.
Go
I
ahead.
spoke too soon. With like, Indivisible, that's part of their agenda. And
Okay.
that's a very wide, group. So it's on their agenda. And, I just wanted to correct myself.
Thank you,
Yeah.
Valerie.
Thank you. I'm Paul, and I will just mention that I'm also a chair of an issues committee at the National Gray Panthers. So this can come up again. If we've got
Great.
national action, we can bring it up. But what happens in this room can move up to a national action as well as state. So Paul?
Yeah, yes. I was criticizing Medicare Advantage before, but in full disclosure, I should admit that I had a brother who was on SSI and therefore Medicaid. And when he turned 65, he became dual eligible. And certainly that had helped him. But it points out that in all these programs, they're kind of winners and losers. You know, some of the legacy union programs, they have Cadillac deals. And I'm on the board of a faith-based nursing home, senior living organization, Evangelical Homes of Michigan. And what I've seen over the decades is kind of a microcosm of our society, that faith-based organizations like that are losing out because people at the high end are going to these really high-end places that are built for them, the people that have money, the top 2% and all. And those people used to kind of subsidize the lower end people.
Yeah, good point.
But then at the lower end, we have people, I know a couple of my colleagues who have started Medicaid, what I call them Medicaid mills. They do the very minimum to qualify to get federal dollars, but they're really not places where we would want our families to be. And they make all kinds of money off of that. And, you know, like the David Cotton's zoo thing, you know, that's how he made his money. I know him
That's
personally.
right. Yep.
And also, so in the end, I think what we need to push for is a universal health care, like Medicare for all, single payer, because otherwise that's the only way we'll get equity. Our societies have become more and more unequal in the last 50 or more years. And it's showing up certainly in healthcare. And we all need a basic good program. I mean, the well-to-do people don't want a program where they're going to have their benefits lowered. But I say you have a good program for everybody. And then if the wealthy want to buy their high-end stuff, you know, their swimming pools and bowling alleys and so on, and their senior living, fine. But let's take care of everybody with good medical care for all. That's the important thing. And Gary
Agreed.
Peters, I've known him for decades. My daughter used to babysit for him, and I tried so hard to get him to support Medicare for all. He did support the Affordable Care Act, and he also stood up with the shutdown that he didn't give in. So I give him credit for that.
Yep, me too.
But maybe we can still work on him more before he's out of office. And I share your dismay that he's leaving at a crucial time.
Okay.
Dr. Paul, you just reminded me. So during my practice years, I took care of a lot of patients on Medicaid. And one of the things I did when I was the medical school dean, I said, okay, look, people who are on Medicaid have a hard time getting in to see doctors sometimes, because as soon as it shows up their insurance is Medicaid, the doctor says, yeah, well, you know, we'll have an appointment for you in 9 months or something like that. So I came out with a plan, which was this. For all doctors in the state of Michigan who don't see Medicaid patients, we're going to put a tiny little tax on your billings, and that will support doctors who will see Medicaid patients, and it'll increase. Well, this is the first time in my life that I actually ever got hate mail.
Yeah.
Yeah,
You're doing
my
something
box
right,
filled
huh?
up with it. However, what ended up happening was both Wayne State University and Henry Ford were given special dispensation because they took care of so many patients with Medicaid to get a slight increase for specialty care, which ended up being millions of dollars.
Yeah.
Anyway, I just want to underline your point. When you have all these different insurances out there, well, then you have a system by definition that will be unequal.
Yes, and I could just emphasize that too, is in my career in high-risk obstetrics at Beaumont, in the OBGYN, I think we were the only group that took all comers, Medicaid, Medicare, of course, obstetrics, you didn't have Medicare,
Right.
all insurance or no insurance. And there was not, I think, one private doctor on staff that took Medicaid GYN patients, and only one or two that took Medicaid OB patients. So that's a problem, and a great
So
problem.
we have time really for one more question. And Dave has had his hand up for a while. And then we're going to say thank you to Bob Frank for his presentation. But Dave, did you still have a question?
Well, I guess it's more of a comment than a question. And I think Paul reiterated what I was going to say. I've been with Michoacan, Healthcare for All. I've wore that button 15 years, almost every day. And when I was in the hospital at Henry Ford, I got a quadruple bypass a few months ago, and thank God I'm doing great. But I kept talking about Medicare for all. I mean, healthcare for all. And I was convinced, and I still believe, I've changed my mind totally. I believe Medicare for all is the answer. I have a friend that lives just a block away, a couple blocks away, and he's got improved Medicare for all and Medicare for all. He's got the two signs in his yard. And I'm a believer now. I don't want to say, because healthcare for all can mean, and some of us have been around long enough to know there were people that wouldn't march with people that said healthcare for all because they wanted single payer, and they wouldn't. We've always believed to get healthcare for every American, however you do it. But
Yep.
I'm a believer now, and I think almost all doctors would go along. I mean, currently practicing doctors, probably 100% of the ones that are retired, but the ones that are practicing would agree with Medicare for all. Because I think Bob talked about it earlier. You get a Medicare reimbursement, you can expect it. You know you'll get it. You know it's there, and it's in you can count on it. But anything else is still questionable. But Medicare for all is, to me, the answer, and that's the sign I carried on the 19th with my upside down flag.
Well,
Very
thank
good.
you, Dave.
Good for you.
And I'll just say, Gray Panthers, for those who may not know, has been standing for universal health care since the very beginning of when it was started. And I've been involved with it since 1978 here in Michigan. But in either case, healthcare for all fits right in with one of our goals. So those of you who care about healthcare know that you should have people in Gray Panthers who do care about this issue a great deal. So this is a time where we're going to say thank you to our speaker, and then I'm going to give some concrete ways that we will be saying thank you. But if those of you who would like to be able to raise your hands or send out some love messages from your Zoom screen, this is the time to do that. Okay.
Thanks so much, Randy and Gray Panthers. It's been delightful.
So love for Bob Frank right now. That was a thank you. We're going to give you 2 or 3 things, though. Number one is that you'll get a free membership in Gray Panthers.
Looking forward to it.
Look at that. You will, and then secondly, you'll get a Gray Panthers t-shirt.
I'll wear it.
So you just have to send me your size. And then number three, we're going to be, our board typically gives an honorarium to the organization of the nonprofit organization of your choice. And we had this conversation actually just before this meeting, but Bob had suggested he'd like, unless you change your mind from an hour ago, you want to be able to give our honorarium to the Michigan Universal Healthcare Network. So that's
We
kind
need
of
it.
our three
We
different
need
ways of saying thank you, Bob. And we
Very
welcome
nice.
you into our movement.
Thanks so much.
Thank you,
And-
Bob.
Thank you.
And
Okay, I'm
again,
going to say goodbye, Randy.
sure. And
Okay.
all of those, and I
Good to see everybody.
I also want a little shout out to Valerie. We can check out after the meeting, but it's been a while. I consider you a friend over the years, and I was excited to see that you're going to join us this morning. So,
Dr. Paul, I just want to ask, Dr. Paul, did you go to Wayne?
No, but I practiced at Beaumont for 35 years, and we used to go down to Grand Rounds when Bob Sokol was chairman there.
Oh, yeah. Okay. Good.
Remember Bob?
Oh, yeah. Bye, everybody.
yeah, and those of you who are not on our board, we will be starting our Gray Panthers board meeting shortly in a few minutes. We'll give people a little time to grab a bite to eat. But those of you who are not on our board, you're more than welcome to stay and to see how we do business. If you want to become a board member, have a conversation with us, but you will not get to vote, even though you're sitting in on our board meeting that comes up here. So that's the 1, 2, 3 about welcoming people who are not on our board, but that you at least know that we continue to be open to your ideas. So